네. 그 아스마. 아, 네.
Buat dulu, lambat gila.
Apa?
Sekejap doktor. A minute. Okey. Boleh. Ni? Okey. Sekejap.
Belum start lagi kan?
Belum. Ini apa?
Soalan apa yang aku letak sana?
Ya, masa soalan dia orang kan boleh komen lagi kan? Sebenarnya.
Saya nak cuba. Macam I nak tunjukkan ni kan. Kamera nampak tak di sini?
Okey, tak apa. Masa kan?
Oh, okey. Nak tunjuk lah.
Okey, doktor. Standby. Ni tu Okay guys, everyone. Good afternoon to all. Okay, today as I promised, we have our Facebook Live for the one topics that hello. Okay, alright. So the topics today is about the in conjunction for the World Asthma Day. The topic is about inhale and exhale. The exploring asthma type update in treatment and inhaler innovations. So before that, I will introduce our speaker today is Dr. Lavanya Narayanan, graduate from MBBS in 2013 and obtained her graduate in MRCP in the UK in 2017. Dr. Lavanya has special interest in diabetes management and metabolic medicine and is currently pursuing Master of Science in Diabetic Care at the University of Warwick, Cambridge. She is an advocate for using digital tools to share health resource and information to help patients achieve optimal health, which aim to develop Malaysia's largest online medical library for postgraduate in line with digital education and the development of virtual delivery of medical education. She joined KMI Taman Desa Medical Center as a resident internal medicine physician and diabetes specialist in July 2023. Okay, so doctor, the floor is yours.
Hello. Can you guys can you hear me? Ni dah tahu dah kat sini saya. Yes. Okay, hello everyone. So I'm back again after just talking to myself for the last 5 minutes or so. Okay, apologies for that. Thank you for tuning in today's FB Live. I'm Dr. Lavanya, a consultant physician and diabetes specialist in KMI Taman Desa Medical Center. So for the World Asthma Day that was just yesterday, today I'm going to be talking about asthma. Okay, so what is asthma? We'll be looking at the different types of asthma, how do we identify asthma, what are the new changes in asthma treatment that has been discussed in 2023 through the global initiative of asthma management, as well as the different types of inhalers that are available. So I'll share with you all a few tips that I have with me right now, and another very important way on how we can monitor our asthma symptoms. So since this is an FB Live, keep your questions coming, your opinions coming in and your comments. I will read those relevant ones and I will share them with the rest, and I will address a few questions if we can. So let's start off with what is asthma itself. So asthma is a chronic disease, penyakit kronik yang melibatkan keradangan saluran pernafasan atau saluran udara. So what happens here in asthma? Exact cause is not identified, or we can't really put a finger to what exactly causes asthma. What we understand is that it's a very complex situation involving environmental factor together with genetic factors. Putting that both together, that kind of has an impact on the immunology or the immune response of the person towards a trigger factor or allergen. So there are many situations where one can have an episode, and that is depending on what type of asthma you have. So commonly, the types of asthma that we see out there is childhood bronchial asthma. Many of them get diagnosed when they're younger in their age group, and then later on, the care is then transitioned to a physician. The symptoms of asthma, as we all know, starts off with coughing. So one actually would have coughs during the day, during night, sometimes more towards the night, or during the day. It really depends on the timing. Secondly, they can have chest tightness, difficulty breathing. These are among the complaints that they have. So asthma itself is something that is rather manageable if the treatment is correctly given to the patient, and there's good management system by the patient themselves as well as the doctors managing. Childhood asthma is one category. And then for those who had never been diagnosed with asthma, no problem at all. And then later on in adulthood, they start having symptoms similar to asthma. So the first thing to do is identify what is triggering this kind of symptom. Usually, when you see the doctor, they will take a very thorough history from you to identify are there any triggers, or we call it punctus. Okay, what can trigger asthma to happen? Among the common triggers out there would be smoke, okay, cigarette smoke, pollens, certain dust mites, even certain medications as well can trigger asthma episodes. So they come in whenever you are exposed to those allergens or those causes or those factors, and the symptoms actually resolve once you are not exposed to them anymore. So these are the important things that need to be taken by the doctor who's seeing you in the clinic. They need to take a very thorough history, and from there decide once the cause or the trigger factor, the conjunctus is identified, then it's much easier to manage the symptoms. But in a whole, when we talk about asthma, it is actually a chronic inflammatory disease. That means it's got to do with keradangan, right? Keradangan saluran pernafasan, your entire airway system. And what happens here is the or hyper responsive. They become triggered, they become narrowed, and even the mucus secretion from these airways are not cleared up easily. Because of that, you get obstruction of your airway. Whatever sounds that you actually hear when you're breathing, those are sounds of obstruction. So the wheeze that you hear, that's an indication of an obstruction. Similar goes to the other symptoms as well. So overall, if you were to understand asthma, it is a chronic disease. It has got to do with the allergic components since young. It is something that is manageable. If you want to ask whether can it be treated to cure, that's not something that we can confirm. And what we are very sure about is that these symptoms can be reduced, they can be managed, they can be prevented, hence rendering you into a state of asthma episodes, and only with very, very severe exposures that you get those symptoms very rare. In this hands on, this will ensure you would have a good quality of life. You know, you can carry on with your regular activities. You are able to take up sports. You're able to do anything that you want. So essentially, being asthma free is something possible with good control of your symptoms. So it's essential to meet your doctors, identify what type of asthma you have, how severe is your asthma based on your control. These are again questions that the doctors will ask you. And after that, being sure about the treatment of asthma. Um, Once you're given the treatment for asthma, typically they come in inhaler forms, all right, depending on what type of asthma you have, what stage of asthma you have. And I'll be sharing with you some updates on the treatment as well. Importantly, once you're given the treatment, you need to know how to use those inhalers well. And many times when the controls become poor, we realize that one of the causes would be poor technique of using the asthma inhalers. All right. So far, any questions? I'll move on with the next part, which is looking at the updates in management for asthma. So since our viewers today are mixed big, as well as some doctors perhaps or healthcare workers, maybe it'll be important for us to just share how the transition of the asthma management has been over the years. So it started off with short-term, short-acting bronchodilator or fast-acting bronchodilator, and that's something that I think many of y'all who have got asthma or wheezing at least will have seen. So this is a blue cover inhaler. Essentially, what's inside here is what we call salbutamol or ventilator. Right? So what's inside this canister is really high pressurized medication that's inside, and for each pump, each time you squeeze the pump, it comes out as a mist. So what? So as you can see here, I'm putting it nearer. This is the canister. Now, the problem with this is that sometimes it's difficult to use, especially if you're having an asthma episode or you don't have coordinated breathing. Usually, in children, they find it hard to coordinate their breathing per on instruction, or even the elderly. So we'll usually have a spacer that will be connected to the mouth of this pump. And what you're expected to do is to ensure that it is shaken well, right? There is still medications inside, and sometimes we even ask to try to pump once or twice to see if there's good mist coming out. Ensuring that you are in an upright, erect position to allow good breathing movements, and you'll need to seal your mouth very tightly over the mouthpiece here. All right. So this requires coordination with breathing, and that's why I'm saying it's sometimes a little bit difficult to manage this sort of delivery. All right. So this is called a metered dose inhaler, okay, as opposed to a dry powdered inhaler. All right. Okay. This is acute inhalers, dry powdered inhaler. As you can see, this is how it looks like. Okay. The content of the asthma medicine is also different. What is inside here is a short-acting bronchodilator, okay, which means that it opens up the airway rapidly and it acts for a short period of time. So it used to be used as a reliever, and even up to now, it's still used as a reliever for those who have got a mild to moderate asthma. However, the updates that we see now in China, which is the Global Initiative for Asthma Management, is the introduction of what we call MART, or Maintenance and Reliever Therapy. It is actually a combination of a little bit of corticosteroids or steroids plus a long-acting bronchodilator. This long-acting bronchodilator is a similar one to this one, but the difference is that it keeps it for a longer time. So it is also known as the ubat panca, okay, and also ubat kawalan masa panca. So this combination can only be seen in two forms. One I have here in my hands, it's called Sinicol. This is a combination of budesonide with formoterol. So what is new about it is that this now can be used as reliever and preventer. So you do not need to carry too many pumps with you. If the doctor is starting you on this particular therapy, then you will be using this as a reliever and preventer. Whatever it is, end of the day, that you should be the doctor and the doctor the right treatment for you and understanding how different from the previous ones you are using based on the updates will be something crucial for you to know. So the difference here is that, as you can see, this is a single use dry powder inhaler, but there are 30 tablets that's put inside, and each time you twist the bottom, it'll crush a tablet, and that's what you're going to be inhaling. Sometimes you might feel a little bit uncomfortable after inhaling. Your mouth might feel a little bitter, so we will encourage you to gargle and spit right after. But it's good to also ensure that you stay inhaled for about 10 seconds in order for it to reach the appropriate places. So as I showed you, there are different methods of delivery. One is a mist form like this, the other one is a dry powder inhaler, and you also have the other one called Seritide. It's a combination of salmeterol and fluticasone. Similar, long-acting with inhaled corticosteroids. However, they are not encouraged. This is not encouraged to be used as smart. So that's something new that you want to see in asthma management. Other than that, I would like to also move on now to how do you actually how does the doctor actually diagnose asthma? So there are few methods that we do apart from just symptoms alone. Sometimes we will also get patients to demonstrate how much is the functional capacity of the lungs, and this can be simply done by the bedside or in the clinic or in the office. And what you can do is this is what we call a pictometer. It has a scale here that shows how many liters of air per minute is being exhaled. One very strong forceful expiration. This is the mouthpiece, gets attached here, and all you need to do is seal your mouth very tightly here and give your forceful expiration, the best one you can do after a full inhalation. And when you do that, you will notice this scale moving, all right, as you can see here. You will do it 3 times, and the best out of the three will be taken or considered as the best reading. Usually, we used to follow a chart or a nomogram based on our height and gender. However, incident guidelines, we can also see that the best reading is taken when you are symptoms free. So when you're very well and fine with those symptoms, the best reading out of the three will be considered somewhat like your benchmark. So moving from there, if you are already developing symptoms and you do another peak flow meter, you can see what is the reduction in your peak flow rate. Okay, so that's one technique on how we can monitor our symptoms. Sometimes symptoms can be a little subtle. It can be just cough, um, nighttime cough, cough that sometimes wakes you up at night. And the problem that happens here is many a times adults, when they're not diagnosed with childhood asthma and they start developing cough, this cough gets overlooked and be treated as viral pharyngitis or infection of the throat. Sometimes it can also be mistreated as gastroesophageal reflux disease. So among the things that a doctor should be considering for you is you're coughing constantly, however, you're not getting very ill, the cough goes on and off, sometimes making you feel difficult to breathe, but not so bad that you need to go to the ED. These indications of you might be having some form of obstruction of your airways. So that's something that the doctor can consider and trial of therapy to see if it helps. Okay, so that is treatment as far as treatment is concerned. In terms of side effects, we get a lot of questions on side effects because certain medications they have a combination of steroid component inside. What can it do to my system, doctor? Can I develop all the side? I would like to develop all the side effects of steroid therapy in the long run. That's a very good question. However, the amount of steroids that's been taken in through this dry powder inhaler is extremely low to cause you all those side effects and complications of systemic generalized steroid therapy. But at the same time, the benefit of this drug or this combination of drug and is seen that it is more of a benefit definitely by reducing the recurrence of your symptoms, exacerbations, and the number of hospitalizations due to attacks of asthma. So, however, apart from that, another side effect that sometimes patients complain of after taking this type of medicine is to start having tremors. Start having tremors, you have your heart racing, and that's a rather expected effect of the drug because it also causes those side effects in patients. They are generally short lasting as soon as the effect of the medication wears off, it wears off as well. But however, if it continues further, you should see a doctor and get that addressed. So overall, we have looked at what is asthma as a chronic condition where you would require good monitoring, ensuring that the symptoms are well controlled so that you lead a good quality of life. And that requires both parties to play a role together, the patients themselves as well as the doctors. So each time when the patient sees the doctor, they need to be able to provide a good history on how they are doing in the past 3 months or 6 months, how good are their control of symptoms. And sometimes if they can't word them to the doctor, he would give him an asthma diary. So similar to logging anything else in your day, asthma symptoms can also be logged. And from there, the doctors can see how frequent these symptoms are coming up now. Apart from that, the doctors will also provide what we call an asthma action plan. So, what is this action plan all about? They are given three different ranges of peak flow meter readings based on your best reading. And if you were to fall in those specific groups of peak flow meter readings, then there are specific action plans that you can carry out based on the doctor's recommendation. So if it's very low, past a certain level, that will trigger the red asthma action plan, which will warrant you to go to the hospital immediately to get attention. Okay, so that's generally how we look at asthma. Importantly, is to find out if you're taking the medications correctly. If you find your symptoms are not getting better despite the doctors giving you the treatment according to the dosages, then you will need to see the doctor again, demonstrate the technique of inhalation one more time to see if you're doing it correctly, and then seek and see if there are any other causes that's causing you this problem apart from asthma. Okay, so that's all I have to share about asthma this time. So if there are any questions you would like to ask, you can always send them to our website and Facebook page. We will address them accordingly. Thank you very much for joining in today.
Okay, thank you so much, Doctor, for the so informative talk that you have give it to us today. So, if there is no question, I have one question for Doctor. Okay, inhaler, right? Is it the okay? You said have a few type of inhaler, right? So, is it has that type? Adakah ia memerlukan jangka umur? Maksudnya the youngest tak boleh guna yang macam ni ataupun yang kanak-kanak dia ada inhaler yang tersendiri. Hmm.
Okay, thank you Iqbal for the question. So generally, inhalers yang kita gunakan ini, ia bergantung kepada jenis ubat yang ada di dalam lah. So ubat ini yang saya tunjukkan dalam kanister biru ni adalah sesuatu yang boleh digunakan kepada kanak-kanak. Tetapi cara pemberian ubat ini haruslah berbeza sedikit daripada kalau kita berbanding dengan dewasa sebab dia memerlukan effort untuk tarik nafas dan hembus. Jadi biasanya kalau perasan kanak-kanak yang ada mungkin masalah asma ni, diorang akan ada spacer di mana setiap kali pam ini ditekan, ubatnya akan disalurkan kepada kanak-kanak tersebut melalui perlakuan spacer. Ini akan memastikan supaya keseluruhan ubat daripada satu pam tersebut itu akan sampai ke saluran pernafasan kanak-kanak. Itu dari segi pemberian delivery of ubat kepada kanak-kanak. well, jenis ubat-ubat yang kita ada, of course dia akan berbeza bergantung kepada umur kanak-kanak dan juga berat badan kanak-kanak. Saya rasa itu bahagian doktor kanak-kanak yang biasa akan menguruskannya. Bagi dewasa kita ada dos-dos yang tertentu juga bergantung kepada setakat mana severe atau seriusnya masalah asma mereka. Selain itu, dari segi ubat steroid yang saya baru ceritakan tadi, iaitu steroid di mana dia ada kandungan ubat steroid dan juga simbikot di mana dia ada kandungan steroid juga. Daripada panduan yang saya pernah lihat untuk kanak-kanak, dia diberi untuk kanak-kanak yang lebih daripada umur 5 tahun. So, kalau ibu bapa nak consultation ubat mereka adalah terbaik, kita jumpa doktor kanak-kanak mereka dan dapatkan confirmation dari segi dos, dari segi pemberian ubat tersebut supaya simptom-simptom asma di kalangan kanak-kanak ini boleh dikawal dengan baik. Kalau bagi dewasa, senang sahaja jumpa physician ataupun doktor pakar perubatan yang merawat asma atau doktor perubatan lain yang merawat asma mereka dan dapatkan nasihat yang betul berkenaan pemberian ubat, cara pengambilan ubat. Kalau ada apa-apa side effect ubat yang mereka tidak boleh terima, ubat harus diubah dan juga kontrol simptom-simptom kawalan simptom-simptom mereka. Kalau mereka boleh beri maklumat tersebut kepada doktor, doktor boleh tentukan jenis ubat yang diperlukan, sama ada dos ubat yang diperlukan atau tidak. So, I hope it answered your question, Iqbal. Alright, so we have got a question. Can asthma be cured, doctor? So it is a common question when we encounter any kind of diseases now. When we say disease, all we want to know is if the disease can be cured. Right? So the asthma falls in a category of chronic. Talk about penyakit kronik, maksudnya penyakit itu akan bersama kita, tetapi kalau kita boleh mengawal simptom penyakit tersebut, kita boleh hidup seperti mereka yang tidak ada masalah penyakit ini. Okay, that makes sense. So the symptoms can be managed and can be prevented, and that will render you into a state of living a usual healthy life with very, very minimal or need for hospitalized treatment. If that makes sense. Okay, so to answer directly, there's no specific cure for it. It means you won't be asthma free, but it can be symptoms free. That's a possibility. Thank you.
Okay, thank you so much, Doctor, for the answer. So I hope the talk that has given by Dr. Lavania today has been help us to know more about asthma. Okay, so kalau tak ada soalan lagi, alright, I think that's it. Thank you so much, Doctor, for once more time. Terima kasih banyak-banyak.
Thank you, Iqbal, and thank you, Kemai, for having me today to speak a little bit of asthma and sharing some knowledge around. Thanks.
Okay, thank you so much, Doctor. So, guys, kalau ada apa-apa pertanyaan, boleh hubungi kami ataupun boleh terus datang ke Hospital KMI Taman Desa Medical Center. Boleh buat appointment dengan konsultan kami. So, kalau tiada apa-apa lagi, so terima kasih banyak kepada semua yang masuk live pada hari ini. Thank you so much. So, thank you so much, guys. Bye-bye. Bye.